Yes, you can be a candidate for natural cycle IVF if you have a diminished egg reserve. In this kind of process, we do not give any fertility medicines. We track the natural egg or follicle that you produce every month and retrieve it before you ovulate. So the whole focus is on the quality and not the quantity. So that's the advantage. But the disadvantages are that we might lose the follicle because of ovulation and we might not be able to catch it before we can retrieve it. Hence, the chances of cycle cancellation are much higher with natural cycles. On an average, we collect 10 to 20 eggs per egg collection. Younger the female, better the egg reserve, more are the number of eggs collected. Studies have shown that in younger female who are less than 35, collecting more than 10 eggs does not improve pregnancy rates. But in older population, number of eggs collected has a direct correlation with the pregnancy rates. We can do a day 2, day 3 or day 5 transfer depending on what we have. At Bone Hall, if we have multiple good dividing embryos on day 3, we always aim at a day 5 transfer, which is called the blastocyst transfer. The advantages with blastocyst transfer are that the implantation rates are high and we are able to choose that single best embryo that we can use for transfer. In case we have less number of embryos on day 3, then we aim at a day 3 transfer. And in case of natural cycle or modified natural cycle IVFs, where we are just talking about one egg and one embryo, literature supports doing early transfer as early as day 2. If your embryos are suitable for freezing, we freeze them. And if your embryos have been tested through pre-implantation genetic testing and they've come back as abnormal, we discard them with consent.